structural deficiencies in access to personal assistance for children with autism, consequences for care and the child's best interests. Today, it is unreasonably difficult to obtain personal assistance for children with autism, despite the fact that their needs are often extensive, complex, and lifelong. Many families describe the same recurring pattern. They apply for support under the Act concerning support and service for persons with certain functional impairments, LSS, but are instead referred to social services rather than being granted the assistance to which the child is entitled. The result is that children with significant disabilities end up in a system that is not adapted to their needs, while parents are left without genuine support in everyday life. A fundamental problem is that the LSS is, in practice, being applied increasingly restrictively. Personal assistance is now primarily granted only in cases of very extensive and strictly measurable needs, which means that many children with autism fall between the cracks despite clear functional impairments. When LSS support is denied, families are often referred to social services, whose mandate mainly concerns investigation, supervision, and in some cases coercive measures, rather than long-term, preventive support in daily life. This creates a serious legal and rights-based problem. The child's needs risk being misinterpreted as parental shortcomings, when in reality they are the result of insufficient societal support measures. Instead of providing the child with appropriate support at home and in school, the focus shifts to investigations of the family and, in some cases, to interventions that further destabilize the child's situation. At the same time, there is a concerning development within healthcare, where psychotropic medication is increasingly used for children with neurodevelopmental disabilities. Sedatives, antidepressants, and antipsychotic medications may in certain individual cases be medically justified. But research and clinical experience also show that these drugs can cause serious side effects in children, such as increased anxiety, behavioral changes, emotional blunting, and impaired cognitive development. When a child's symptoms worsen, there is a clear risk that this is interpreted as more problems or additional diagnoses, rather than critically examining whether the ongoing medication or the stressful life situation itself is contributing to the deterioration. This can lead to an escalating treatment trajectory, with more medication instead of more support. It is important to clearly distinguish between well-founded criticism and incorrect claims. Vaccinations do not cause autism, a fact that has been firmly established in extensive international research. The criticism instead concerns how easily children are, in practice, sometimes medicated to fit the limitations of the system, rather than the system being adapted to the child's needs. Children's brains are still developing, and every medical treatment must be preceded by careful assessment, clear indication, follow-up, and real alternatives in the form of support interventions. A commonly cited counter-argument is that societal resources are limited and that personal assistance cannot be granted to everyone. The crucial question, however, is what the alternative costs. When children do not receive appropriate support in time, the risk increases for mental ill health, school failure, breakdowns in family situations, and ultimately coercive measures and placements. This is not only humanly unacceptable, it is also economically short-sighted. Children with autism need safety, continuity, and individually adapted support, not a system that casts suspicion on families and medicates away symptoms. Personal assistance should be a fundamental support for life and development, not an exception that has, in practice, become nearly unattainable. If children's rights under national law and international conventions are to be taken seriously, society must stop economizing on the most vulnerable and instead listen to those who live with the consequences every day.